So thank you. So I'm very pleased to have the opportunity to address you today, but especially to meet the Minister. And I'm very pleased to learn about his willingness to cooperate and to continue working with the European institutions. And we look forward to doing that. What I would like to cover is just indicate three sets of issues which I think will be the basis for our discussions and collaboration with the Greek government in the years to come. The first set of issues is actually just the implementation of the very wide set of reforms that have been introduced in recent years to control healthcare spending. Now, a vast number of reforms have been introduced, everything from the promotion of genetics, establishing or trying to establish clearer diagnostics and protocols for the provision of healthcare services, a whole vast range of reforms. I think the key message is some progress has been made, but implementation until now has been lacking in key places. And there is a lot of a lot of scope for savings, which is still there, have not materialized due to, I think, insufficient implementation. So whether it's on generics, whether it's on diagnostic protocols, whether it's on more centralized procurement, the continued rollout of primary healthcare centers, I think the first priority has to be implementation, implementation, and implementation. This brings me to the second issue, which I think needs to be looked at again, and that's the issue of the clawback. Now, the clawback was introduced early on in the program essentially as a device to control healthcare spending. It was a fiscal measure, okay? And to a large extent, it actually has been effective. It has brought the levels of spending on healthcare down towards the levels one observes in other European countries, okay? However, we increasingly see the level of the clawback every year is going up. And so it is not working in exactly the way that it was intended, in the sense that it's not providing an adequate incentive to the government to implement the structural reforms needed to control healthcare spending. So we feel there's an imbalance in the current way the clawback operates. That's not to say that there should be no clawback, but the system needs to be rebalanced so that it's fair, so that there is, on the one hand, an incentive on both industry and the government to control healthcare spending and implement structural reforms. And then the third set of issues, which needs to be looked at, is actually just the level of public spending on healthcare in Greece. Now, I know the Minister will like this statement, because what I'm going to argue is that the level of public spending on healthcare in Greece has now fallen fairly significantly below the level of spending in other European countries. And it would be important, in our view, going forward, as part of the discussions that we will have with the Minister of Finance, to see if additional fiscal space or some additional fiscal space could be found to increase the level of healthcare spending. Because in and of itself, some additional spending may be needed to actually implement some of the structural reforms necessary to control public spending. So those are the three issues: implementation of the reforms, taking a look at the incentive structure and the clawback, and making sure that adequate resources are found within the overall budget for spending on healthcare. Thank you.